The protein that we are particularly interested in is a protein called A20. It's my favorite protein because it can downregulate this inflammatory response. And it does this in you and me whenever we have an infection. It's there to terminate, to make sure that the inflammation at some point stops. But we also know that in chronic inflammation and in children with atopic asthma, they just don't have enough of this protein. If you don't have enough of this protein, you don't downregulate your inflammation, and that means you have more inflammation and you have more asthma symptoms. So for our study, we have now looked at a list of drugs that are already available for the use in humans, so they're licensed drugs, and we are looking for those drugs that can upregulate or can increase the amount of this protein. If we have more protein of this A20, then we should have less inflammation and less asthma symptoms. But there are a lot of drugs out there that we could hopefully find a new use for them. And that's what our study will address. So we've used a bioinformatics approach, and this has predicted drugs that will be able to induce this protein A20 that will help children with asthma in Northern Ireland and beyond.